Okay, it's 2 o'clock and we'd like to welcome everybody to the webinar. Thank you for joining us for our series, How to Identify and Reduce Allergen Exposure. This is part 3 of our 4-part series. This part is going to be titled Diagnosing the Factors of Building-Related Illness. This is part 3 of a 4-part webinar, and it's going to be focused on building environments. Each episode is 30 minutes and focuses on the building's environment and air quality. Contents of the presentation will be made available to all who attend the webinar or are interested afterwards. A certificate of attendance by EDLab at Pure Control Services will be provided to those who will attend this webinar. A raffle for 5 $10 Starbucks gift cards will be held after the webinar for attendees who correctly answer the 5 quiz questions that we will be presenting today alongside the webinar. The winners from part 2, which was our last part, are Masood Asadi, Gerald Cohen, Glenn Collins, Kyler Lundman, and Peter Rowett. Congratulations, and please contact us with the address that you want your gift card sent to. So in the past couple webinars, we have gone over an overview of indoor environments and indoor air, the optimization of IEQ for health, energy, and comfort, building health and factors to be examined, and the importance of building examination outcomes and its interpretation. Today what we're going to be covering is building health-related issues, important factors, effective investigation, best practices, and regulations. Dr. Sahai, how about you start us off now with building health-related issues?
Yeah, that's a very good starting point. Again, welcome to all of our participants, and thank you, Ronnie, that we are going to emphasize this particular segment. It is very important segment of our 4-part webinar series. So what we are going to discuss here is that you might have heard very frequently indoor air quality, indoor environment quality issues. But is there any science behind that? If that is a science-based or evidence-based problem, then we must understand it. So in order to understand that, I want to first give you at a glance view that what could be a real indoor air quality or indoor air quality situation. So the very first thing which we need to understand is that sick building syndrome, because if people start complaining that if they are going in a particular type of building, they feel sick, they don't feel good, and sometimes they confuse, even they cannot explain or express themselves that what is happening to them. So the sick building syndrome are an acute or comfort related issue experienced by the occupant linked directly to the time spent in the building. So what are those symptoms? Some of the symptoms include headache, dizziness, nausea, eye, nose, throat infection, and dry or itchy skin, difficulty in concentrating, and fatigue, sensitivity to odor, hoarseness of voice, allergy, cold, flu-like symptom, increased incident of asthmatic attack, mood, and personality changes. These are some very frequently reported systems, and I said you that these symptoms are if it is not directly related with a particular type of building and it's not a periodicity is known, then it is kind of very difficult to investigate. As you can see that US EPA has considered 1 out of 4 building as a sick building. That makes sense, Ron?
It sure does.
The continuation to the building related health issue, there is something called as building related illness. This is a little bit different than sick building syndrome, because in this particular issue, the diagnosed illness directly linked to the exposure of building contaminants, meaning that there is an evidence that if you're going in that particular building, you are going to get some kind of symptom which is linked with a particular type of symptoms, such as Legionnaire disease, respiratory issue, chill, muscle ache, fever, and others. This is very, very important and significant, and especially the Legionella disease is on rise. So we should be careful. And as you said, again, I want to give a little bite here that poor indoor air quality may be the issue, and that issue is not affecting 1, 2, or 5 people. It is like 64 million workers experience 2 or more symptoms from these listed listed symptoms like infection and muscle ache, fever, etc. Now, the third part of it is even more weird, and that is dirty sock syndrome. If I want to explain it in a nutshell, this is nothing but it is a sort of odor discomfort and basically a foul smell in building environment, especially after turning the heating, ventilation, air conditioning system on, the dweller experience or the occupant experience. And that not only give them the odor discomfort, but they also show some sort of allergy and asthma kind of symptoms. Toxic substance from the fungal and bacterial origin may cause that, because there is no good evidence at this point that from where the odor is coming. I hope, Ronnie, you have at this time a question for our viewers, right?
Yep, we're going to go ahead and launch our first question. Make sure everyone's paying attention. Hopefully get some people some Starbucks gift cards. So first one is, SBS stands for what? Sick building syndrome, sick boy syndrome, sick building SAM, or none of the above? Give everyone about another 15 more seconds. Okay, and now we're going to go ahead and close the poll, and we'll share the results with everyone. And it looks like everyone's paying attention right now. We got 100% picking the right answer of sick building syndrome. Now we'll continue with the webinar. Dr. Sahai, go ahead.
All right. So now, what are the important factors? I have said you what could be the health-related issue. So basically, this whole component can be studied in 2 parts and 2 segments, if you will. First one is the outside factors that are very important, what we experience inside, and obviously some of them were the indigenous or inside factor. So outside factor, mostly the environmental pollution, biological activity, chemical toxin, and radiological substance. You might be wondering that many times if you go in the big cities around that, there is a big chimney and stuff, continuously a smoke is pouring out from there. Those smokes are containing a lot of particulate beside the chemical substance, and that is sort of creating the nuisance in the ambient environment and ambient air, and that's how the air get transfer inside, and that they can bring those kind of substance. Biological activity wise nature, there is a lot of deterioration activity going, especially underneath of plant canopy. If you see that there is a lot of dead leaves and barks and everything there, so that is a very good substratum for that. So these are some important outsource source. Now let's do the inside source, and we will be just focusing on inside source because this is the indoor air quality problem. But at this time, I think, Ronnie, you have a question.
I do. Let's make sure everyone is still paying attention and see if they're ready for this. Question is, important symptoms of DSS are: is it bad airflow, water leaks, odor discomfort, or none of the above? Give everyone about another 10 seconds. We'll go ahead and close out the poll now and share the results. 60% of you got it correct. It is odor discomfort. Now, as Rajiv was, Dr. Sai was saying, we're going to go ahead and continue with the important factors for inside of buildings.
Inside of the building is pretty important and sometimes out of sight, out of mind kind of equation work, and we just simply do not practice some of the very simple stuff which we can utilize to make our air very clean and pure in that way. Those factors include the activities, various activity in a dwelling place, the material, meaning the building material itself should be maintained properly, kept properly. Building envelope is the another thing which is very important, and we need to pay attention, because if there is a breach in the building envelope, obviously there is a breach in the limiting membrane or limiting factor of the building, and that's a big point where you can get like a lot of outside pollutant just like in filter inside. Pressurization is the another issue. Heating, ventilation, air conditioning system is identify one of the very important component of the whole equation, because these are the lungs of building. So if it is not being kept properly, obviously everybody has to pay the price for that. Ventilation and filtration is one of the very good point one should be paying attention, because if the ventilation and filtration is not adequate and not proper, there is a lot of indoor air quality problem is going to happen just with the internal source, meaning the inside source. Building stationery and furnitures are the other probable place where a lot of problem actually originates within the building. And obviously the building water system is a very important component for transporting the water in the building, but if it is not maintained properly, obviously it is going to carry a lot of biological and abiological pollutant throughout the building, and once you use those water or the water system, then these are going to create trouble.
Okay, so we've talked about building health-related issues. We've talked about the important factors. Can you go ahead and explain about how you go about having an effective investigation when you find out that there's these issues?
Well, this is the key element of the investigation. How you can make your investigation really effective? That's the question. Well, that start from the hypothesizing the problem. When you receive a complaint from a complainant, and then what are the issues they are raising, based on that, few simple steps can address a lot of things. First thing first, one should need to understand the environmental condition or parameter that include but not limited to the temperature. That's a very important factor. Relative humidity, light, and odor. If you monitor these 4 listed components, it is going to be very helpful in the bigger picture. The second important element, I would say, the biological entities such as bacteria, mold, fungi, pollen, and other allergens that include various insect-based allergen, plant or other animal-borne material, such as dust mite. You got various kind of plant trichome. You can have the cyst, various kind of protozoan cyst, etc. And then obviously the rodent, cat, then dog, then cockroach. These kind of things are also very significant, and they are identified as a potential source of allergen generator in a way. Then the chemical concern is also very important to evaluate and investigate, and mostly these comes from various kind of furnishing and furniture within the closed environment. Those important chemical include but not limited to volatile organic compound, formaldehyde, pesticide, etc. And obviously the radiological issue, you might have heard alpha, beta, gamma rays, that kind of thing, that those are the radioactive or radiological issue. And typically the ultraviolet rays and the radon, etc. is considered very significant from indoor air quality or environment quality point of view. Now, So what you do, what are the effects and prospects? So what it can be doing to you and how to address them. You can experience symptoms. If you start experiencing symptoms, then you can be like, putting the building related issues or sick building syndrome we were discussing earlier. And then you have to probably a hypothesis like what symptom you are getting, how you can link. So you have to hypothesize the whole thing. Once you have a hypothesis, then you need to got a clinical manifestation, because then you have like, cause or causal organism identification, that what is causing it, and is there any significant or is there any relation between the cause and the symptoms. So then we can address. So these are some few very good mechanisms doing the proper effective investigation. In next slide, I would like to show is the, like, if it is a multi-home building or office building, then you can see in the same structure, some places, as you can see, it is enhanced in the first circle, that looking cleaner than the bottom circle. And what is happening that if you are taking or collecting the sample from the top circle, then perhaps you are not going to get much, because the problem was actually in the bottom circle. And since this is an office building, they might be, sharing the same air conditioning ventilation system. So the problem which is being generated in the bottom circle or in that particular office may be distributed throughout this building. So sampling and testing a strategy should be determined very carefully, and it should be very minutely crafted based on certain information, such as studying the problem where the people are complaining most versus the non-problem area where people are not, like, getting that much of experience of bad symptom, etc. Then monitoring versus sample collection. Sometimes the monitoring is going to tell a lot of things, such as higher humidity, higher temperature, lower temperature. These kind of thing is going to tell the vulnerability of that particular space for infection. Whereas sample collection become prudent when you see the odd numbers, and they are such as, like, very high humidity, or you are seeing some visual growth or anything like that need to be collected so that laboratory confirm the finding. Then there are certain things which you can do on site, but certain tests must be examined or evaluated by the laboratory, such as humidity, temperature, availability of light, etc. can be tested on site, and rest of them, such as like testing mold, bacteria, etc., should be laboratory. Now, the other very important part of the whole equation, meaning the investigation, is the report versus the result. Once you get the laboratory report, it's just not merely a few pages of documented history of that building, but you can also get some very good insight that what it could be or it may be going to turn as a result, whether you will be experiencing problem or not. I believe, Ronnie, at this time you have a question.
Yep, we're on to question number 3 now. Which one of the following is not due to biological agents? Is it bacteria, mold, fiberglass, or mites? Give everyone about 15 seconds. Okay, now we're going to go ahead and close the poll. See how everyone did, and 89% of you got it correct. We're going to go ahead and continue with the webinar.
So, problem and control is a very, very significant part of the indoor air quality, indoor environment quality, or building related issues. So what we can do, we need to find out the causal factor. That's the very important thing. Once we find the causal factor, then obviously if there is a problem, then we need to initiate a corrective action for that. And once the corrective action in place, then it not only properly address the issue, but if it is not going to happen in future, we must do something about it, and that is called as preventive action. So we need to design a bunch of steps which can support, once you fix a problem, if there is a problem, that problem is not going to happen. If you do not have a problem, even it is better to implement the preventive actions so that you should not be getting those problems. So you list down those steps very clearly: what was the problem, how you fix it, and what options you have exercised that it is not going to happen again. And that's something called as best practices. I would say that the best practices is one of the very good preventive action in a way, because you create a proactive building management. Make sure that you, if it is an office building and it's a fully functional building, that we must have a core people to address and look after the building functionality in general. For that, you need to have a committee or something which can be assigned with a specific task, so that those things are not going to be creating the trouble for the occupant. Avoid the deferred maintenance, because the first thing go is the maintenance that goes once belt is tight. So should be avoided in lack of fund or any other compulsion. Educate the occupants and dwellers on the hazard and public in general. Also determine some action plan, that if one kind of problem happen, that what is going to be your response, so that may be in place. And obviously watch or look out for time to time policy and procedure by the organizations, or one can also create their own policy and procedure so that they can be intact. And I hope at this time you have a question, Ronnie.
Yep. This is going to be question 4 for our webinar. Which is a good example of an effective indoor environment investigation? Is it monitoring versus sample collection, not doing any test, only interviewing the person who made the complaint, or none of the above? Give everyone about 10 more seconds. We're going to go ahead and close the poll now. And 67% of you got it correct. The good example is monitoring versus sample collection. You want to make sure that the actions you're performing in an indoor environment are appropriate, and whether that be monitoring to make sure everything's fine, or actually collecting samples because things are not going so well.
So you might be wondering that what are some few good steps of the best practices, because it is hard to find the reference that what you should be doing and what you should not be doing. So you can see in this picture that there are two type of building we are trying to focus here. One building which is sort of naked building, not properly sealed. Other building has proper seal and stuff. So we need to do some very simple steps, such as roof and other building leaks can be identified. That's one of the very important step. The ventilation control in the building, how the ventilation is being, is a natural or versus artificial or man-made. Temperature and humidity, like how the temperature and humidity is behaving, what kind of factors are influencing those. Lighting or source of light, how deeper the light is going, or what is the penetration of light inside a building. Building water system, from where the water is coming, how the water is disposed, etc. Those are other stuff. Then the quarantine practices, like if there is a known source that can bring pollutant inside the building, then need to be quarantined. Then the renovation mechanism must be as per the law or as per the recommended guidelines, so that you should not start floating the particulates or the pollutants all around. Contamination monitoring is the other way to evaluate, to understand that what kind of problem or what kind of source or what kind of causal entities are within the building. And obviously corrective action and preventive action is initiated in order to successfully implement the best practices. So the regulation, this is one of the things which I want to give some input, because right now there is no universally accepted guideline for the indoor environment or air quality. But I want to let our viewer know that, like, the United States Environmental Protection Agency is continuously working on that, not really having a very restrictive guideline for the indoor air, but they have, like, the National Ambient Air Quality Standard, and that monitor for the carbon monoxide, lead, ground level ozone, nitrogen oxide, particulate matter, and sulfur dioxide. But you see that none of these things are, like, having the threshold determined for indoor environment. But I'm happy to report that as per the US EPA, that since 1970 this have been improved, meaning the quality of these various particulates have improved, and we are growing at a pace of, I think, 246% so far the domestic product is concerned. But the average problem for the air quality issue is dropped about 70%. So that's a big achievement in a span of, like, past 3 or 4 decades. Now the other thing is that the biological entity must be, like, paying attention, because sometimes it has a direct reaction with the human health, and that's why it is very important. And soon I believe that EPA or other organization can, like, give their input. But a lot of people are working, various schools and thoughts are there. It is nothing that there is nothing in the field, but everybody has their own approach to address this problem. So that is a very this problem is really hard, and we need to address it properly. Radiation is the other stuff, such as radon, and that kind of problem is happening due to that. So that is also very important, and there are certain regulations by the EPA on the radon emission. Then there are certain other, I would say, main point identified for the indoor environment or indoor air quality kind of issue. Those are the dampness and mold in building, building ventilation, construction, and renovation. People do not typically follow that. They said, oh, this is not going to create any problem, I'm just renovating, adding another room. But yeah, there is a lot of particulate matter discharge, and that is going somewhere. The chemical and odors are the other stuff which can be, like, given due importance, and it need to be analyzed, sample need to be collected, etc. And the health hazard evaluation is the one which is very important. People should be educating that what are the hazards they are going to create. And there are a lot of countries in the world, they have a program where they train their citizen by letting them know that what kind of pollutant can create what kind of problems, so that citizens are kind of aware of that, and they can do their part.
Okay, now that's the end of the webinar, but we do have our final question. A good example of best practices for IEQ, IAQ is education, action plan, policy and procedures, or all of the above. Give everyone about another 10 seconds. And we'll go ahead and close out this poll, showing that 100% of you got it correct. It was all of the above for best practices.
I also want to make sure, Ronnie, that, like, if someone has question, they can always send us an email, or if they have some question real quick, we can answer, or otherwise, I guess, Ronnie, we can take the next part, right?
Of course. We want to thank everybody for joining us today. We would love to see everyone come in for our last part of the series. This would be part 4, establishing a building baseline for prognosis. Final installment will cover different types of indoor environments and what to expect in the prevailing situation. The acceptance criteria for good indoor environmental quality will also be discussed based on the outcome of hundreds of thousands of samples analyzed by us, the EDLab, collected from across the U.S. and from abroad. That will take place on Wednesday, August 30th at 2 p.m., same time. And like Dr. Sahaya was saying, if anybody ever has any questions, we're always free to talk. We love sharing our knowledge and discussing indoor environments and indoor air quality with anyone. Here's contact information for our multiple departments. And once again, thank you all for joining us in this webinar.